Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're glad to have you all here with us this morning. My name is Sunny Lawless, and I'm the volunteer coordinator for the SMP program. I will be your host for this morning, and presenting today we have Johnetta Red, who is a community outreach specialist in Mississippi, and Gayla Yoakum, who is one of our community outreach specialists in Georgia. Today, for the February installment of our Webinar Wednesdays with SMP, we are going to discuss the Medicare Summary Notice, or MSN, and Explanation of Benefits, or EOB. During the presentation, you are welcome to type any questions you may have into the chat, but we will hold those until the end of the presentation when we open it up for Q&A at the end. There will also be a prize drawing for those of you who were registered to attend today's webinar prior to 10:15 a.m. Before we get started, we do have to let you know that this project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official administration for community living policy. The Senior Medicare Patrols are grant-funded projects of the federal U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And last year, we celebrated 25 years of the SMP program. So before we get started today, we do have a quick polling question. Today's question is, are you on Original Medicare or do you have a Medicare Advantage plan? And there's also an option for you to say neither. So let's go ahead and launch that poll. And there we go. So your options are, I'm on Original Medicare, I'm on a Medicare Advantage plan, or I'm not on Medicare. So we'll give y'all just a few seconds to answer this question really quickly for us. We're about at 70% voted now. All right, about 5 more seconds. All right, I'm going to go ahead and close the poll and share the results with everyone. So it looks like 38% said you're on Original Medicare, 25% you're on a Medicare Advantage plan, and 38% of you today are not on Medicare. So this will be important for you all to know since we're going to be discussing the statements that you receive from your Medicare plans today. So now I'm going to turn things back over to Johnetta, who is going to get us started with our first part of our presentation today.
Thank you, Sunny. What is a Medicare Summary Notice? The Medicare Summary Notice, also known as an MSN, is a statement that people with Original Medicare receive. Medicare mails the MSN out every 3 months for their Medicare Part A and Part B covered services. If you don't receive services or medical supplies in that 3-month period, you will not receive an MSN. The MSN shows all the services billed to Medicare, both Medicare Part A, which is inpatient, and Medicare Part B, which is the outpatient. Next slide. So what is the explanation of benefits? The explanation of benefits is a notice that people with Medicare Advantage plan, that will be the Part C or the Part D prescription drug plan, receive after they receive medical services or supplies. The EOB is mailed every month, depending on which Medicare Advantage plan you may have. All EOBs show the same information, but the layout and other specifics may vary based on the plan. Next slide. The Medicare Summary Notice and the explanation of benefits is not a bill. This is a record of what services or products Medicare has paid on your behalf. It's very important that you review your Medicare Summary Notice or the explanation of benefits to make sure that the information is correct. Next slide. Now let's take a few minutes to review a sample Medicare Summary Notice. The first page of your notice will have your deductible status, claims and cost for this period, the total you may be billed, and the provider who submitted claims for that period also. Next slide. The second page of the MSN provides you with information on how to check your notice, how to report fraud, and where to call to get help if you have questions. Next slide. The next few pages of the Medicare Summary Notice provides you with detailed information on your claim. The claim information shows the date of service, the name of your provider, as well as a detailed description of what services were performed. Next slide. The final page of the MSN explains how to handle denied claims and how to file an appeal. For assistance on filing an appeal, contact your state SHIP. This is the Senior Health Insurance Assistance Program in your state. Next slide. If you are on Medicare Advantage plan, you will receive an explanation of benefits, or the EOB, not a Medicare Summary Notice. Your plan will send one of these after services are received. Next slide. Use a personal healthcare journal or a pocket calendar to keep track of services or equipment that you have received. The Healthcare Journal is a booklet that allows you to keep track of every aspect of your medical information in one place. It also includes a section for you to list your doctor's appointments. You can record the date of your appointments, your doctor's name, and the reason for the visit. You can also track the dates you had tests, lab work, or x-rays. Next slide. Always verify the information to make sure that it is accurate. Check the dates of service and match it to your healthcare journal calendar. Keep in mind these questions also. Do you recognize the provider's name? Did you receive the type of services that is listed, such as lab work, x-rays, or other types of tests? Make sure that your provider make sure your provider is charging you the correct amount. Were the charges more, or were they the same? More than once for the same days of service. Review your Medicare Summary Notice and explanation of benefits when it comes to ensure that there are no unusual charges or suspicious claims. If you see something you don't recognize, such as a provider's name, a date of service, or a test that you did not have, and you are not satisfied with the answer you receive from your provider, or if you don't feel comfortable calling your provider, you can contact Senior Medicare Patrol at 877-272-8720 for help. Now that you've learned a little bit about the Medicare Summary Notice and the explanation of benefits, Gayla is going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse. Protect, detect, report.
Thank you, Janetta. As Janetta said, we're going to talk about the 3 keys to success in preventing fraud, errors, and abuse. The first key is to prevent. Next slide. Protecting your personal information is your best defense against healthcare fraud and abuse. Never give your Medicare number to a stranger. Treat your Medicare and Social Security numbers like your credit cards. Remember, Medicare will never call you and ask for your Medicare number. Please don't carry your card unless you need it for a doctor's appointment. Always make sure that you keep a record of your medical visits in your healthcare journal or in a calendar like Janetta was talking about earlier. Next slide, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. You want to make sure you review your Medicare statements for mistakes. Compare them to your personal records, like Janetta had said earlier about documenting when you go to the doctor in your healthcare journal or in your tracker. Compare those to your Medicare Summary Notice or your EOBs, your explanation of benefits from your insurance company. Again, your Medicare Summary Notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive those healthcare services. Make sure you compare your statements to those personal records and look for these items to detect. Charges for something you did not get, billing for the same services or supplies twice, or services that were not ordered by your doctor. Next. The next key that we're going to talk about is reporting. Reporting is very important. If you receive a suspicious call, hang up. What you want to do is you want to call your provider. If you have anything on your MSN that you have any questions about, make sure that you call your provider. And if you're not sure and you can't get a resolution, you can always call SMP if you aren't satisfied with that response. Please call 1-877-272-8720 if you aren't comfortable or you aren't satisfied with the response. Next. You might be wondering how you can help and become involved. Volunteers are an essential part to our Medicare Patrol program. We are always looking for civic-minded individuals to join our fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in a bi-monthly webinar and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. I should know, my husband volunteers as well. In the past, we have had couples team up to volunteer, give presentations, and attend community events. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 1-877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can also visit our website, www.stopmedicarefraud.org, for additional information about our program. Additionally, We would like to encourage you to scan the QR code using your camera on your cell phone that will guide you to our social media platforms, including Facebook, Georgia, Louisiana, Mississippi, and our Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcast.
All right, thank you, and Johnetta, for that information on the Medicare Summary Notice and the explanation of benefits. We want to remind you all that coming up next month for our Webinar Wednesdays presentation, we're going to be talking about preventing identity theft. This webinar is scheduled for March 29th at the same time, 10:30 Central Time. So just be on the lookout for the invitation so you can register for that event next month. And now it's time for our prize drawing. So everyone who was registered to attend today prior to 10:15 has been entered for a chance to win. The winner is going to receive their choice of a $15 Walmart or Amazon e-gift card. So give me just one moment to pull up our name wheel. Here we go. All right, so let's give it a spin and see who our lucky winner is today. It looks like Kevin. Kevin is here. So congratulations, Kevin. I will be reaching out to you later today to find out which gift card you would like to receive. And thank you for joining us today. All right, let me get back to my screen here. There we go. All right, so before we wrap up today's presentation, I wanted to open it up to questions. So if anybody has a question regarding the information that we presented today, you can raise your hand and I'll unmute your line and you can ask, or you could always type it into the chat if you would like to do that. We'll give y'all just a moment to see if anybody has any questions. Okay, I'm not seeing any hands raised or any questions coming in through the chat or questions. So this will conclude our presentation today on understanding your Medicare Summary Notice and your explanation of benefits. We will send an email later today with information to a short survey. We would appreciate it if you would take just a couple of moments to fill out that survey to let the Administration for Community Living know how we did today. I also included it in the chat box earlier before we started. We appreciate you joining and we hope you will join us again next month for Webinar Wednesdays with SMP. And I hope everyone has a great Wednesday. We'll see you next time. Thank you, Johnetta and Gayla.
Thank you, Sunny. Bye-bye.
Thank you. Bye.